You have a surgery coming up. That is why you're listening to this audio. And I want to start by saying something that's obvious, but needs to be said. It makes sense to be scared. You're not doing anything wrong. It makes sense to feel how you're feeling. For some of you, that might be scared. For others, maybe just apprehensive. For others, frustrated and angry and irritated that this even has to happen. All of that is valid. If it's something else, that's also valid. And you're not doing anything wrong by feeling that way. Fear before surgery isn't a problem to fix. It's your body doing its job, which is noticing that something big is coming. What we're going to do in the next few minutes is not talk you out of that feeling. We're going to give your body a skill, something that it can actually do before surgery and even in the pre-op room, so that the feeling doesn't have to turn into overwhelm and post-surgery trauma. Instead, we hope it turns into post-surgery recovery. So here's the skill. It's called orienting, and you already know how to do it. Every animal does it. Every human does it. And when something changes in your environment, your head turns, your eyes scan, and your body is checking in on what's here. Where am I? Is this moment right now okay? So let's practice it right where you are. You can keep listening to this while you do it, and let your eyes open if they're closed and let them move a little bit. Not forced, just kind of let them drift and land on things. Let your head and neck turn too slowly, like you have all the time in the world, because right now you do. When your eyes land on something, I want to encourage you to actually see it. The color of it, where it sits in the room. If there's texture, notice that. Notice what happens in your body when your eyes find something ordinary. It could be a door frame, a lamp, your own hands. There might be a small settling inside, a breath that comes a little easier, or a muscle that loosens just a little bit. And if not, that's okay. But if so, that's your nervous system getting the message of, I know where I am right now. I'm in this room and nothing is happening to me right here, right now. Take your time with this. Let your eyes find one or two more things and just notice them. Notice that you're here with these items in this room. Now we're going to bring this skill somewhere a little bit harder. We'll go slowly, and if at any point it's too much, just come back to the room that you're in and let your eyes find something ordinary again. That is not considered failing this exercise. That actually is this exercise. That when you're somewhere fearful, you can bring your mind's attention back to something ordinary. So if you're ready, I want to encourage you to picture the day before your surgery. Notice your room that you're in. Notice your home that you're in. Notice the room you're in. Notice the comforts around you. And notice any feelings that arise, any nervousness or apprehension or excitement or hope that's arising before the surgery. Notice the night before, getting yourself ready to go to sleep, and mentally preparing for what's to come. And now we're moving into the day of your surgery, arriving at the hospital, There's probably cars and loud noises and things that are already maybe starting to make you feel a little bit uneasy. If so, let's notice that and not try so hard to get rid of it. Let's allow it to be there and imagine yourself walking in or being wheeled in to the front lobby, checking in, sitting and waiting. Maybe you brought something comfortable with you, like a blanket or your favorite book or audio. They call your name and it's time to go back. Notice what you're feeling. Know that it's okay to be feeling this. And allow yourself to look around and reach for something that might bring you some comfort. We're doing this instead of squeezing your eyes shut and bracing your body. I want you to imagine doing exactly what you just practiced with the ordinary object, letting your eyes move and letting your head turn as slowly, subtly, gently, and as much as it can. We are noticing that the lights are bright. We're noticing that they're bright so the people who are working on you can see really clearly and so that they can do the best possible job that they can do. There's equipment like monitors, screens, trays, beeping, wheels. In your mind's eye, let your eyes land on them one at a time. Every machine in that room has one job, and that job is to keep you safe. There are people, and their faces are half covered. Let yourself look at their eyes and try hard to notice that these are people with real lives and families outside of here who are just here to keep you safe and do the job that's tasked at hand. These are people who have done this many times, and you don't have to trust them with your whole heart. We know that sometimes things don't go as planned. You just have to let your eyes take them in so that your body knows what's actually in the room instead of only what it imagines is in the room. And notice, even in your imagination, that you can and have the ability to look, that your eyes still move, and that you are in that room, not just having that room happen to you. Part of what's hard about surgery is that at some point you go to sleep and things happen without you. Your body might have opinions about that, very valid and fair opinions. Handing over control is very hard, and no one is asking you to pretend that it isn't. In fact, I'm inviting you to name that. This is hard. Trauma isn't usually caused by the scary thing itself. It's caused by being overwhelmed with no way to respond. And orienting is one way to respond. Every time you scan that room and your eyes land somewhere, your body gets to do something with its fear instead of just holding it. You go into that sleep as someone who looked around first, someone who knows where they are. Your mind doesn't have to do mental gymnastics trying to figure it out while you're unconscious. I want to encourage you to think of a favorite song or a favorite sound or a favorite image that you want to keep with you while you're in that unconscious state. If you could play music for yourself that you did hear the whole time you were asleep, what would it be? Or what movie would be playing in your head? Or painting? would you hold on to? And allow yourself to just be here, knowing that the procedure at hand is a choice, one that you didn't want to have to make, but you did make when life presented you with what it's presented you with. If you're imagining that song, allow that song to come to an end in your mind. And imagine yourself coming awake at the end of the surgery, coming back into the room that you were in, noticing the people around you, noticing the monitors and the screens. Maybe there's less people in the room now because they've done their job and they've moved on to help somebody else. Whoever is there with you when you wake up, I'll encourage you to look at their eyes, notice the humanity in them, and notice the humanity in yourself. This, once again, is not about positive feelings or making yourself feel a certain way. This is simply about noticing what's there so that your brain doesn't have to fill in the gaps for what is. It knows what's there. And now I'll invite you to come on back to the room you're in. Let your eyes move around it again. This room, this moment where nothing is happening to you. And just sit there, allowing your eyes to find something to rest on. Between now and your surgery, you may want to practice this. Maybe it's once a day, or maybe it's whenever the dread spikes. But look around wherever you are. Let your head turn and your eyes land. And on the day itself, in the pre-op, just do the small version of this. Even if it's just your eyes moving across the ceiling or the IV pole or a nurse's face, your body will remember this because you've already shown it how.